CCHT practice exam questions. Which of the following kidney structures connects with and delivers urine directly to the ureter? Calyx, glomerulus, pelvis, cortex. Which of the following statements about administering erythropoietin to a hemodialysis patient is correct? A. Administer it until hemoglobin level is normal. B. Give supplemental iron if ferritin is low. C. Give subcutaneously only. D. Double the dose if the hemoglobin has not increased by 1 g/dl in 4 weeks. Answer. B. Give supplemental iron if ferritin is low. All of following conditions are associated with chronic kidney failure except A. Low hemoglobin. B. Hypoparathyroidism. C. Hyperphosphatemia. D. Hyperkalemia. Answer. B. Hypoparathyroidism. One difference between peritoneal dialysis, PD, and hemodialysis, HD, is A. There is a greater incidence of disequilibrium syndrome in PDB. There are more dietary restrictions in PDC, fluid buildup is less of a problem in PDD. The patient is subjected to constant dialysis in PD rather than intermittent dialysis in HD. Answer. D. The patient is subjected to constant dialysis in PD rather than intermittent dialysis in HD. Uremia may cause which of the following conditions? A. Edema, swelling, of the extremities. B. All of the above. C. Anemia. D. Itching. Answer. B. All of the above. The most likely cause of postrenal failure is A. Severe dehydration. B. Nephrotoxic drugs. C. Glomerulonephritis. D. Benign prostatic hypertrophy. Answer. D. Benign prostatic hypertrophy. What pattern of blood chemistries would you expect in renal osteodystrophy? A. High calcium and low phosphate levels. B. Low parathyroid hormone levels. C. Elevated calcitriol. D. Low calcium and high phosphate levels. Answer. D. Low calcium and high phosphate levels. What percentage of transplanted kidneys is functional 1 year after transplantation? A. 70%. B. 90%. C. 30%. D. 50%. Answer. B. 90%. Peritoneal dialysis, PD, differs from hemodialysis in which of the following ways? A. PD requires both vascular access and abdominal access. B. Sterile dialysate is not required for PDC. PD cannot be done at home. D. PD access is by an intra-abdominal catheter. Answer. D. PD access is by an intra-abdominal catheter. A hemodialysis patient suddenly develops trouble breathing, hives, itching, and hypotension. The most likely causes A. Air embolism. B. An anaphylactic reaction. C. Angina. D. Disequilibrium syndrome. Answer. B. An anaphylactic reaction. The most common cause of chronic kidney disease in the United States is A. Diabetes. B. Hypertension. C. Glomerulonephritis. D. Polycystic kidney disease. Answer. A. Diabetes. Which of the following dialyzers is used currently? A. Coil. B. Flat plate. C. Hollow tube. D. Keel. Answer. C. Hollow tube. All of the following substances are produced by the kidneys except A. Renin. B. Aldosterone. C. Erythropoietin. D. Calcitriol. Answer. B. Aldosterone. The main difference between an arteriovenous shunt, AVS, and an arteriovenous fistula, AVF, is in A. AVF is more likely to become clotted or infected. B. AVF is entirely within the arm. C. AVS is entirely within the arm. D. AVF requires an external tube. Answer. B. AVF is entirely within the arm. All of the following substances are produced by the kidney except A. Erythropoietin. B. Calcitriol. C. Aldosterone. D. Renin. Answer. C. Aldosterone. A patient undergoing hemodialysis complains of muscle cramps in the calves and feet. All of the following are likely causes except A. Hypernatremia, high sodium level. B. Excess fluid removal. C. Hypercalcemia, high calcium level. D. Hypokalemia, low potassium. Answer. C. Hypercalcemia, high calcium level. All of the following conditions are associated with chronic kidney failure except A. Low hemoglobin. B. Hypoparathyroidism. C. Hyperkalemia. D. Hyperphosphatemia. Answer. B. Hypoparathyroidism. The glomerular filtration rate is an important index of renal function and in the normal adult is approximately A. 125 ml/min/1.73 m2 B. 75 ml/min/1.73 m2 C. 200 ml/min/1.73 m2 D. 50 ml/min/1.73 m2 Answer A. 125 ml/min/1.73 m2. Uremia may cause which of the following conditions? A. Itching B. Edema, swelling, of the extremity C. Anemia D. All of the above Answer D. All of the above. The most likely cause of postrenal failure is A. Severe dehydration B. Nephrotoxic drug C. Glomerulonephritis D. Benign prostatic hypertrophy Answer D. Benign prostatic hypertrophy. The most common cause of chronic kidney disease in the United States is A. Diabetes B. Hypertension C. Glomerulonephritis D. Polycystic kidney disease Answer D. Polycystic kidney disease.